My name is V.Ram Krishnamoorthi. I'm a general internist at the Hines Veterans Hospital outside of Chicago. And I've been asked to provide some comments about veterans' health care in the VA system. It's true that many opponents of healthcare reform have actually used buzzwords like socialized medicine and government-run healthcare as being proxies for an inferior or substandard sort of care. And they point to the VA system as an example of that substandard care. Well, I, along with many of my colleagues in the VA system, can attest to you that our health care, especially in the primary care and the outpatient care clinics, is among the best care available in America. In fact, evidence has shown that VA primary care and our clinical outcomes for preventive medicine are among the best of any hospital system in the entire country. Veterans come back to us, even veterans who have other health insurance options, even elderly veterans who have Medicare, come back to us because they're satisfied with their care. The notion that the VA system is somehow substandard, inferior, the horror stories that people hear about vets being neglected in the hospital are stories from decades ago that have unfortunately somehow lingered on and are now, at least at our institution, a thing of the past. We've updated our computerized record system, which is the best electronic medical record system in the country. We coordinate care among our primary care doctors and our specialists. We keep people at home instead of hospitalizing them by providing them home care services, home nursing, home physical therapy. We have a telephone care program so that vets can always receive a telephone triage for acute problems or chronic medical problem questions from a nurse and receive care from physicians. Our physicians, and I included, never have to worry about whether an insurance company is going to call us up and tell us that you can't do what you're doing. We don't have to worry about what kind of insurance a veteran has. A story that I have to tell, just last week I was working in the emergency department and a VA employee who is not a veteran had an emergency situation. She had to come to the emergency department and I had to admit her into a hospital. Since she's not a vet, she can't receive inpatient care at our VA. So I called up the hospital at which her doctor was working and to try to get her admitted. The first question out of that doctor's mouth was, what kind of insurance does she have? That was out of a physician's mouth. That patient also had to wait for another 7 or 8 hours until she could be safely transferred to that hospital. Whereas that kind of care in our VA system is expedited more quickly. So I'm proud to say, as a VA general internist, that we have great health care. And yes, it's government-run health care. And even though that might not be the system that all Americans want, I know that the elements of our system, primary care, coordination of care, prevention of medical problems, and management of chronic disease conditions is something that we need to spread to all Americans. Thank you.
Thank you, Doc.